And joining us tonight for this special report and call-in show on News 12 is Dr. Bruno Casanova, the chair of the Women's Health Department and Advantage Care Physicians of New York. Welcome. Thank you so much for giving us your time tonight.
No, thank you for having me.
Absolutely. So just first, before we get to our viewers' questions, want to go over the newest updates from today. The coronavirus pandemic, Governor Cuomo giving out a potential start date for some regions of New York when it comes to unpausing New York. So today, Cuomo announced that they are looking at May 15th as the beginning of eased social distancing restrictions. It'll be done on a region by region basis, only areas where there have been a decline in hospitalizations for 2 weeks. We know that obviously everyone is very eager to know when this will all end, and of course we've been all thinking that for weeks now. But let's get to Dr. Casanova, because we are joined by you tonight. Our viewers about to call in with their many questions. How has the experience been for you? This is the first time we're meeting, virtually, and the first time you're coming on the call-in show, which we really, really appreciate, because our viewers have honestly more and more questions as the hours pass, to be honest. So what has the experience been with Advantage Care Physicians, and from your perspective?
So let me just tell you a little bit about Advantage Care. Advantage Care Physicians is one of the largest private practice groups in New York City, in the New York metro area, as a matter of fact. We serve more than 500,000 people in more than 40 offices. Advantage Care Physicians not only takes care of patients in office, but we also provide virtual visits. What we are doing during this pandemic, which has touched us all in so many ways, from the personal standpoint to the professional standpoint, we are providing care mostly for City of New York employees, firefighters, police, subway, buses, anyone who works in these areas. We test for COVID-19 in our offices. And we focus mainly on that group, but we also take care of patients who have symptoms and call us with their problems. We have a virtual visit with them, and then they come to one of our offices and get tested. What we're trying to do is we're trying to take away a little bit of that burden that falls usually on hospitals, and then we bring it to our offices so the hospitals can actually take care of the more complicated COVID-19 cases. We also have COVID-19, but we try to take the not so complicated cases and preventative cases as well from hospitals.
Which is so interesting. We had another doctor on from Advantage Care Physicians last week, and just hearing about the virtual care and the telecommunication that you guys have been doing is just so important during this time, obviously.
Yes, you're absolutely right. And let me tell you, medicine is not going to be the same after this crisis. In the past, a month or two, medicine has changed so much, more than it has changed. The way we provide care has changed more than it has changed in the past 15, 20 years. And when going back to what you were saying about virtual visits, 97% of our patients love virtual visits. And if you think about it, you have a time that you show up, you're going to be seen at that time. You can't be late. We have to comply with that. We can have conversations one-to-one. You know when to start, you know when to end. And then if we need something else, then we can bring you to the offices, and then you can get care with us in one of our multiple offices in all regions.
And Dr. Casanova, as the chair of the Women's Health Department there, such a unique thing that we can kind of specifically talk about with you. As we know, our women are on the front lines of this, as a lot of people are, but according to federal census data, 76% of healthcare workers are women, and we know that in our transit system, our delivery workers in restaurants, we know women are there. They're the home health aides. They're doing everything, as they do all the time, but especially during this pandemic, extra added stress. In terms of COVID-19 specifically, are there certain things that you've either noticed with certain symptoms that more women are experiencing rather than men? Or, are there certain things that women, I guess, should keep an eye out for that you've noticed at all? Or?
Well, the symptoms do not vary depending on gender. So if whether you're a male or a female, symptoms are the same. statistics nonetheless show that women are, although are as affected as men, the numbers are a little bit worse for men, usually because men have certain underlying medical conditions that increase their propensity to get COVID or to get the worst cases of COVID. So it's not inherent to being a man or a woman, female or male, that increases your chances of having COVID. Women, nonetheless, deal with a major difference, pregnancy.
Right.
So when you have a woman that is pregnant and is dealing with COVID, that changes the game completely. If you don't mind me explaining this, normally women, pregnant women, are at a higher chance. Their immunity is a little bit lower than non-pregnant women. So that puts them at a higher chance of certain infections, among them COVID-19.
Which is definitely scary. And I know over the weeks, as we've been doing this show for more than a month now, we've gotten many calls from extremely nervous and scared pregnant women from around New York City. I mean, I could only imagine. I do want to get to our first call, because just in case it is a pregnant woman, but I know she has a question for you. This is Jasmine over in Coney Island. Jasmine, can you hear us?
Yes, I can hear you.
How are you, and what is your question tonight for the doctor?
Yeah, hi, doctor. Hi.
Hi.
I'm calling because my daughter's 22 years old. She went to visit her boyfriend, and over there visiting him in New Jersey, she ended up contracting the COVID. Prior to her getting tested, she was sick 5 days before she got tested. She got tested on the 15th. She came back positive on the 16th.
Thank you so much for being with us here for another night of this coronavirus special report that we're doing each weeknight. We want to thank Dr. Casanova for being here with us. And I know we got cut off on that very important question, though, about if a pregnant mother can pass it along, COVID-19, along to their child when they do go through giving birth.
That was a very good question, by the way. So there have been reports. Of course, there's no randomized clinical trial. That takes a long time. But there have been reports of women delivering babies in China and here in the U.S. showing that the pregnant women do not have a higher chance of transmitting the virus to the patient, to the baby through the placenta. Like I was mentioning before, the virus goes through droplets. So what I do recommend, nonetheless, and we all recommend, is once the baby is born, you have to take certain measures to prevent you from passing the virus to your baby. Now, some people is like, so you shouldn't be breastfeeding. No. You should breastfeed, because through the milk, you can actually provide antibodies to your baby. But you got to be careful. That means you have to wash your hands thoroughly. You have to cover your mouth and take measures of cleaning the devices that you're going to use if you use a pump before, breastfeeding your baby. Wow. So, no, you don't have a higher chance of passing the virus to your baby, at least not through the placenta.
Yeah. Huge sigh of relief to Sheila and so many other women here in New York City that are pregnant right now. Sheila, we wish you the best. Thank you so much for calling in, and thank you everyone for being with us here tonight. Welcome back to this coronavirus pandemic special report. We are going to get right to some callers lined up for Dr. Casanova, who's joining us tonight. Let's get to Laquana, who's over in Bed-Stuy. Can you hear us?
Yes, I can hear you.
How are you doing? Hope all is well.
I'm doing fine.
Okay, good. What's your question tonight?
Well, my question for the doctor, I know he specializes in women's health care, but when did they begin testing? Because this is actually my medical group, and I called about testing as well as visiting a doctor after, and I didn't really get any clear response. Well, I wanted to get testing. I understood. I go to the Brooklyn Heights Center, but my mom goes to the one in Bedford-Stuyvesant, and there was, the recording said that there was no testing available, but as far as in the Bedford-Stuyvesant location, the doctor wasn't getting back to you right away. So I wanted to know, is testing now available? And if so, how could you get it? as well as what is the turnaround time for the doctor to contact you back when you call about an appointment or a virtual appointment?
Thank you for your question. Yes, we do have testing in each region. We have an office or two in each region that carry the tests. We have both tests. We have Advantage Care Physicians has the antibody test, and we have also the PCR test. The PCR test is the most accurate, is the current gold standard to elucidate if you have or not the virus. Now, when it comes to how to get tested, the way it works is we have to get you a virtual visit. I'll make sure that I get your information from the producers after this interview. So we're gonna get you should get a virtual visit with your PCP, and then after the interview, the PCP will consider if it's necessary or not to get the test. Once you get the test, we will inform you to about which office you should be going to. If Bedford is one of those who carry the tests, not all offices carry both tests because we are just getting implemented with everything, but we test everyone, and the turnover is pretty fast, let me tell you that.
Gotcha. Okay. So do you need to exhibit symptoms first? Is that what that virtual visit will be about, or you just need the visit to kind of get on the record before that test is made and administered?
Very good question.
Yeah.
Very good question. Yes, we're following the CDC guidelines and the New York State Department of Health guidelines. So we currently have to find we offer testing to those who are at a higher chance of being infected or who have symptoms, mostly the latter. So that's why, because let's be honest, there's not enough tests in New York yet, so we have to prioritize.
Yeah, and we're definitely hearing from our leaders, especially our governor, that that's hopefully about to change with everything being ramped up. So we're in the middle of that. But Laquana, thank you so much for your question and calling in and getting a direct answer in terms of your locations and what you want done. So hopefully that works out, and we'll definitely give you, Doctor, the contact info for her.
Thank you.
Let's get to Darlene, who's over in East New York. Darlene, how are you?
Hello, I'm fine. How you doing?
We're good. We're good.
Hi.
Happy to be here with
That's
you.
great.
What's your question?
I just want to know, I have like a lot of menopausal women at work. We just want to know what would the symptoms be, or would they be the same? Because, you get the hot flashes and stuff like that, and we heard that the corona is, don't take too much to the heat.
I hear you. Look, it is true. It is hard to figure out if the symptoms that you may be having are related to menopause, which include hot flashes, mood swings, vaginal dryness, decreased sexual desire, things of that sort. So, and those that are from coronavirus. The coronavirus in about 25 to 30% of patients can give you fever. So it is easier to figure out if you have the coronavirus by checking your temperature, because when you have hot flashes, you don't have a fever. Well, hot flashes related to menopause. You feel hot and you sweat when everyone else is wearing shorts and t-shirts. I'm sorry, where everyone else is feeling cold, you feel hot, but that doesn't translate into a fever. You don't have a temperature that reaches 100.4 or above. With coronavirus, you do have a fever. So it's a fever that is giving you the sweating and feeling hot, as opposed to, the hot flashes.
Right. Hard distinction sometimes, especially when obviously COVID-19 is on everyone's minds. It's the second you cough or the second you feel a hot flash, you're like, what is it though?
And even more now that the symptoms of coronavirus, as the governor was telling us today, we have many other symptoms that we didn't have, we were not considering. We hadn't, but we were not considering 3-4 weeks ago.
Exactly.
So, yes.
Yeah. All right, I do want to quickly get to Sheila, who's calling from Morris Heights tonight. Sheila, can you quickly ask your question so we can get to it?
Sure. Hi, Dr. Casanova. My name is Shayla.
Hi.
I just wanted to call in. I am 25 weeks pregnant, and really just had a specific question on in pregnancy. Obviously, our immune system is, a little lower. If I were to contract COVID, which I have not, would that be delivered onto my baby via, like, through the placenta and all of that, or after giving birth?
Very good question. I hope we're able to finish this answer in this segment. If not, we're going to go on the next one. But basically what happens is the virus does not cross the placenta. That I can tell you for sure. The virus is transmitted through droplets. So I'll amplify later. But,
definitely, because this is definitely an important one. Thank you, doctor, for making that short, but we're going to be right back to finish that. We'll be back.
To my house, I'm not putting my family here in too much danger. Because we came back negative, me, my husband, and my little daughter. We're negative.
I understand. So according to CDC guidelines, 7 days from the moment that the symptoms begin, the patient should have 72 hours without a fever. And her respiratory symptoms, or his or her respiratory symptoms, should be improving in order to be able to go back to regular activities. Nonetheless, and we have seen this even in famous people, who appear on TV, every day, you can still have some symptoms. You may not be able to communicate the virus to others, to infect others with the virus, but you can still have symptoms, because what the virus does, it creates an inflammatory reaction in your body. And let me, and I'm sorry I'm going back, but let me just clarify one thing about pregnant women. I know it doesn't have to do with this question, but the virus, pregnant women do not have a higher chance of having the infection compared to non-pregnant women.
Got it. And good to just continue bringing up the CDC guidelines. It's so hard for so many families, especially like Jasmine's. You want to get your family all back together in the same home, but if one person's sick, what do you do? So again, we just gotta get through that time that the CDC tells us, you just gotta make sure you're okay, especially without that fever for 72 hours, like the doctor said. So let's get to a social media question, because it goes back to the pregnancy situation. We are gonna be back right after this break with that question and more from our viewers. We'll be back.